Welcome back again to our program here. Ask Dr. McCord, Dr. Allan McCord here at East Chiropractic, and we're continuing our series of questions that come up about health and chiropractic care. Today's question is, how we've heard that chiropractic care is advanced and you're now using computers. How does that actually work? Well, we're going to answer that question here on this episode. Stay tuned. Dr. Allan McCord coming back to answer that question about how is chiropractic care advanced and that you use computers in your practice and how does that work? Well, I've got a couple of tests up here that we actually will show you in just a minute, but we do use computers, and actually we've been using computer diagnostic work since 2002 here in our practice, and we use this every day. And one of the tests that's come about that I absolutely love is a computerized muscle test. It's actually manufactured by a company called Vision, and they do another test called a dynamic test. But today I'm just going to show you the standard test that we use on most all of our new practice members that come in, and that is what we call a surface electromyography test, surface electromyography, or abbreviated SEMG. And this is a static version of it. So what you're seeing up here on this board is this was an initial test done. You can see the ideal, and that's listed in the green arrows there, or the green bars. And you want balance, that's what that's showing. Of course, you can see the model of the spine there. And if the spine is balanced and working correctly, you're going to see green readings. And over here on this side was the actual test of that patient, where you see not only some green, but then you see some yellows and definitely some red bars here, with the reds being longer, yellows being more moderate. And that's showing the higher levels or moderate levels of muscle tension. And actually what this gets a chance to show the patient is actually what we feel when we do a palpatory test, when we actually feel up and down a patient's spine. But we actually can show that to the patient after we do one of these computerized tests. And to do that, we use a dual probe instrument that's actually Bluetooth into the module. And these are probes, and so we would take these probes and scan 24 spots down the spine. And it takes about 90 seconds to run this test. And you can see there's 5 electrodes here on each one of those probes. And we actually can then show the actual muscle tension that's associated with what's going on in the spine. And what's really great about this is it's non-invasive. In other words, it's not like a ultrasound test. It's not like an MRI. It's not like a X-ray where there could be potential damage to the tissue cells. Actually, this is just receiving the information. And so here in the test, and we do a follow-up then, about 10 to 14 visits on average, about 12 visits out. So you can definitely see a definitive difference here in what's happening with the patient's spine. And this is a report that we would show to the patient on the following visit once we do the second test. So here was the original test that coincides with this page here. And then this is the follow-up test, so we can actually begin to show the differences that we're making when we make adjustments. Here on this, on these sheets, actually is what we would call the range of motion graphic report, and we use these probes. That's again tied Bluetooth to our major control unit, and we put these on the head and the back of a patient, ask them to bend, and it records the angles of motion. And we have 3 levels of the neck, or 3 planes of the neck motion, 2 of the lower back version, and you can see these pie pieces here which would correlate to the actual degrees of motion that a patient has. And there's normals that are established for each one of those panes, so we can actually show a patient how their flexibility and mobility is. One of the things that we know clinically with subluxations is that when you're subluxated, there's parts of your spine that can actually be restricted. They actually would restrict the normal motion or hold back the normal motion of those joints and regions of the spine. And so you can see, again, the follow-up test that we do sometime afterwards, showing the differences of increases in the range of motion. And so this is basically an answer to the question, and we can actually take and send these right to your cell phone on a smartphone capacity phone that you have. We can take this test, email it, or text it right to you so you can actually have that instantaneously to take home with you. And there's other definite computer types of care and diagnostic work that have been advanced in the last several years with chiropractic. But this gives you some level of an idea of some of the tests that we do and how computer systems actually can help our practice by establishing a baseline for a patient, showing them the differences, and actually confirm that. And what's really great is the patient gets better as well. And sometimes symptoms don't really change much, but the actual functional test will change. So it's just another piece of information that helps us enhance our practice and provide the best care to our practice members here. So I hope that answers your question. Thanks again for joining us. And I know want to actually send you to our website, which is kenteastchiro.com. And make sure you subscribe to our YouTube channel at Ask Dr. McCord. Thanks again for joining us at Ask Dr. McCord. Have a great day.